So number one, what are the symptoms of someone who is low in testosterone? Okay, so I would say the commonest cause that people come to see me is patients where I test for testosterone levels are low libido, low sex drive.
What's a low sex drive?
Well,
Like, is there a measure to that?
There's no measure. There are questionnaires. The ADAM questionnaire. It's to check for androgen deficiency in the aging male, and it's a series of questionnaires rating how your sex drive is, and it gives you a score. But these are just sort of tools that we use. Most patients come in and say, look, you know, I'm not in the mood. My wife thinks I'm cheating on her or something. I don't have the same sexual desire that I had 5 years ago.
So that really comes down to your testosterone.
Often,
Okay.
Yeah, we'll talk about that. We'll get into some of the details, but that's the commonest cause, a low libido. Erectile dysfunction alone, you know, like I feel like I'm in the mood, but my erections aren't as strong as they were. That could be a sign of low testosterone. Some people say, well, my thought process is more cloudy, fatigue, I'm trying to do exercise and I'm barely making it through and I'm not building any muscle mass and I'm gaining some weight and no matter how hard I try, I can't, I don't see any results. So these are some of the general signs of testosterone deficiency. This is something that can be easily measured. It's a simple blood test. You know, I see patients who are on testosterone from other doctors or they picked it up at the gym from on the black market and they've never been tested. I think that's unsafe. Absolutely. It's very easy. We can check the testosterone levels.
It's a blood test, right?
It should be done it's a blood test. It should be done in the morning because your testosterone actually varies throughout the day. Okay. So to get the levels at a standard level, it's normally done in the morning, let's say between 8 and 10 o'clock. We like to see 2 tests, maybe a couple of weeks apart or a month apart to really confirm that the testosterone is low. And there's different forms of testosterone. I think we can say that for another day, but there's the total testosterone and there's the bioavailable and free testosterone. All that to say is the most accurate is what we call the bioavailable testosterone. And I really insist on all my patients getting that because I've had patients who have been symptomatic and haven't been treated because their total testosterone is normal, and then we actually dig down deep to the more sensitive bioavailable and it's actually low. Okay, that's number one. And I don't need the testosterone to be, you know, 0. If someone is even in the lower range of normal but symptomatic, today's guidelines say, you know, treat them, give them a shot at 3 months and see how they go. You don't have to be in the basement. And you also have to take into account the age because the testosterone level of a 20-year-old is going to be much higher than a 60-year-old.
At what age does it decline?
It starts to decline in your 30s by a couple of percentage a year on average.
Is it like compounded or like you lose 2 and then another 2 and another?
Well, yeah, I mean, it keeps dropping in some men, but some men it drops higher than other men. Or faster than other men. And
is it a genetic factor?
I don't think there's any genetic factor I've come across in terms of testosterone deficiency. There are other medical reasons. I'm just talking about your standard case of low testosterone. There are actually some brain tumors that can cause an increase in the hormone prolactin, which can decrease your whole axis of brain to testicles, because actually the testosterone production is controlled by the brain. Hormones that come from the pituitary gland.
Wow.
So, just to keep it simple, I'm talking about the run-of-the-mill low testosterone levels and